Welcome, Doctor. Now, moving on right into the issue. Recently, there was a study carried out called Starting Families, and it was amongst 1,000 women in Asia who are all trying to conceive. And 51% said that maybe they thought infertility was if you could not conceive, for 1 year, after 1 year of trying. How close are they to the definition?
Well, I mean, the definition is 1 year of, trying, and you're unable to conceive or unable to get pregnant. Trying here means, having sex at least 3 to 4 times a week, unprotected, i.e. with no barrier methods or no contraception. So that is for a younger couple, couples less than 35. In here I'm speaking about the women, women less than 35. Of course, if you're more than 35, it should be 6 months or earlier before you seek for help.
Right.
So speaking about infertility and being fertile, is this only an issue for women?
No, it's a rule of 1/3. 1/3 happens in the woman, the female, 1/3 in the male, 1/3 in both the male and female, because it takes two to tango.
Yeah.
And about 10% of cases is unexplained. We don't know a reason why, despite extensive investigations. Then, of course, there are other gynecological conditions which are also very common, such as polycystic ovaries, which is a common cause of irregular periods, and endometriosis, which is a common cause of painful periods. So it's a third male, a third female, a third both male and female, and more problems are happening in the male these days.
Which is surprising.
Yeah, nearly 40 to 50% of problems can be attributed to the male.
Yes, you hear that, gentlemen. Maybe you should go and get yourself checked up too if you're facing fertility issues. Now, you've discussed some of the causes, but could we look into more causes of infertility?
Okay, in the female, a common cause of infertility is, of course, irregular periods, something like polycystic ovaries. But before I come to those causes, age plays a very big role.
Yeah.
It's best that you conceive before the age of 30.
True.
All right? Women are delaying their childbearing. They want to become professionals, they want to become CEOs, they want to become head of departments, and then they start trying at the age of 30, 35, and then it may be too late. Before the age of 35, your monthly chances of getting pregnant is about 50 to 60%. After the age of 35, it's less than 50%. After the age of 38, it goes to about 30%, and much less after the age of 40. That is your monthly conception rate.
Wow, interesting information there, a little bit scary.
And I've also heard, Doctor, that if by conceiving after the age of 30, you almost double your chances of getting a high-risk pregnancy.
That's right. Any pregnancy that's above the age of 30 or 35 increases the risk of miscarriages and increases the risk of aneuploidy or chromosomal abnormalities such as Down syndrome, Patau's, and Edwards. That is a common reason for miscarriages in slightly older women, and that's why it's advisable that women get pregnant before 30, and definitely so before 35.
Now, Doctor, if you've already had a child and after your childbearing years, do you become infertile? Is there a risk of becoming infertile?
There's no reason for you to become infertile,
Yeah.
unless there's a change in circumstances. Either there's a change in partner, where a sperm problem may be the issue, or sometimes it may be a complication that has occurred during pregnancy that affects your reproductive tract, and there may be, say, a problem with regards to the tubes or something like that. So it's not common for women to be infertile after having their first pregnancy. Of course, you must look at the time frame between the first pregnancy and the next pregnancy, what the gap is, and you should take age into consideration also. Tubal factors or tubal damage may be a reason why women have secondary infertility.
And when you say tubal damage, could you explain a bit more about that?
Well, basically, in order to get pregnant, you need to have a healthy sperm, you need to have healthy eggs, you need to have sperm deposited at the right place at the right time, and egg released at the same time, that is during ovulation. The egg and sperm must meet, and this usually occurs in the fallopian tube, and then the fertilized embryo then moves to the uterus, and then it grows within the uterus, right? So if there's a problem with regards to the transport system, which is the tubes, and if that is blocked, then the egg and sperm cannot meet.